Our next guest and I have worked together on the what you might call the front of the healthcare front for a long time, working on projects like Medicare for All and reining in big pharma so that people are safer and not ripped off. And she is a leader in this area, in my opinion. Diane Archer is the founder and president of Just Care USA, which is a media hub dedicated to health and financial issues, especially facing boomers, older adults, and their caregivers. And Diane, as you know, I'm not sure if boomers and older adults are separate categories anymore. She's the past chair of the board of Consumer Reports. She was the founder and president of the Medicare Rights Center. She's done so much more as well, but she's been looking at, in addition to Medicare for All, other drug issues as well, and I wanted to talk to her about that today. So without any further ado, Diane Archer, thanks for coming on the program.
Thanks for having me, Richard.
So, as I mentioned in the introduction, drug issues, and we've talked a lot on this show about drug pricing and how big pharma rips people off and why they need to be brought in, reined in, and so on. But the issue one of the issues you've been thinking about lately that I feel we haven't covered enough on this program is the question of drug safety and how possibly the profit motive and the political power of the drug companies affects drug safety. So I wanted to talk to you about that a little bit because I think there's a perception, perhaps, well, I don't know, I'm going to let you explain it, but I feel as if sometimes drugs are rushed to market not because people need the medication, but because it suits the bottom line of the drug companies. But what do you think?
I think that's a fair assessment of the situation right now. We all know that the standard that the FDA uses for approving a new drug is that it must be, quote unquote, safe and effective. But the question is, how do they determine whether a drug is safe and effective? And that is based sometimes on clinical trials and sometimes on lab tests. And those trials tend to be quite narrowly focused on just a small number of people over a short period of time. So as a result, the results of the trial may not show safety issues, may show that the drug works better than nothing at all, because that's what the test is. Does this drug do better than a placebo? But after it is approved by the FDA, lots of safety risks may emerge and often do emerge. And again, that's because over time, lots more people take the drug, and the drug ends up having different effects on people once it's out in the real world and not in a laboratory setting.
So, a number of thoughts related to that. One is, I think that the drug companies actually fund a lot of this research as well, and if that's the case, then there's a built-in conflict of interest, I would think, among the researchers. And it also made me think of the comment that Dr. Marcia Angel, who is a physician who is the editor of the New England Journal of Medicine for many years, perhaps the premier journal besides The Lancet and maybe a couple others in the world on medical research, said that basically after 25 years of being the editor, she said something to the effect of, I wouldn't trust any clinical trial that was conducted by the drug company's expense. So what are your thoughts on all of that?
I think it's an excellent point again. These clinical trials are often paid for by the pharmaceutical industry and designed by the pharmaceutical industry, or designed by doctors who are paid by the pharmaceutical industry to design them. So they are designed to show that the drug, quote unquote, works so that it will be approved by the FDA. I think another piece of this where there's serious conflict issues is at the FDA. Today, the FDA is funded in large part by the drug makers. The people who are approving the drug at the FDA have their salaries in some part paid for by the drug industry. And
now, how does that work? I'm sorry to interrupt, but tell us how that works.
What I know is only that the drug companies have to fund a piece of the drug approval process, and that was, I believe, put into place in order to help move the approval process along more speedily, to put more money in the FDA. But as a result, the FDA is not only an arm of the Department of Health and Human Services and a government political agency, but it's also in some ways an arm of the drug industry, and really needs to be completely free of politics and free of drug company money in order to do its job in an unbiased way.
And I think that's a great point. And I think one of the other things that people don't understand about drug research, clinical trials, and so on, is that, as I understand it, studies can be done, and they might, for example, not show a benefit of the medication, but they can be not released. They can be held back or suppressed. And then another study can be done. I think of some of the medication research I've looked at that shows, with placebo, a success rate of 32%, with the medication, a success or remission rate, with medication, a remission rate of 34%. So very, very marginal improvement. Drug becomes $1 billion drug. If I'm correct that these are often withheld, it just makes you wonder how many studies didn't show anything before this one came along and just statistically showed a slight effect of the medication.
That is another issue, that sometimes these clinical trial studies are not are buried when the results aren't what the drug company wants them to be. There is now a requirement that at least certain clinical trials need to be filed in a public database. I think you can find them at clinicaltrials.org, but I think there are a lot of open questions as to whether all of them that are not completed end up, being known to the public. And so again, there is information that we don't have about what's happening when the trials don't go the way the drug makers want them to go, and then they redesign the trial and get the results they're looking for.
Yeah, I think that's a really good point about not knowing at what point something has to be disclosed, and do they, for example, pull the brakes if they think it's not going to look good. And I would add to that my assumption would be that there are many, many drugs with massive market share where the research was done before this requirement was put into place. So we still don't know how many times the system was gamed before these drugs went to market.
That is fair. And there's another point, which is that often after the drugs go to market, the pharmaceutical industry pays researchers and doctors to write papers about the drugs. And again, those papers are written with money from the drug industry and are not independent. So they may be peer reviewed, but there's a conflict of interest again when these papers are written and then they get distributed to doctors, and people believe that the drug can work miracles that it may or may not be able to work, but it's all based on biased information from researchers who are getting paid by pharma.
And then once it gets past the research stage, which seems to me to be sort of compromised at every step, even now, you mentioned, if I recall correctly, that sometimes when newer and riskier drugs come on the market, doctors are even paid to prescribe them.
Not explicitly, but implicitly so. So what will happen is the drug companies know which are the doctors who they should be going to promote their drugs, which are the doctors who prescribe particular drugs and who might have an interest in prescribing their drugs. And then they might pay the doctor speaking fees, or they may give the doctor some other types of financial gifts that induce the doctor to want to prescribe the drug, even though it's costlier and its safety risks are less well known than other drugs that treat the same condition that have been on the market a long time.
So we have a system that's compromised basically every step of the way. And, I'm sitting here thinking, well, what can the public do about all of this? Now, obviously, you and I have both been involved in activism to try to change this situation. One of the ideas that Bernie Sanders and other people, but on the political side, especially Bernie and a lot of activist groups, have been trying to push is the idea of importing cheaper drugs from overseas. And what we always hear from people who are too cozy to the drug industry, by which I mean virtually every elected Republican and far too many Democrats as well, although by no means all, what we hear is always, well, those drugs aren't safe, that they're not, whereas as my understanding is, and we've had guests on it, Canadian drugs are subject to, often at the same centers, the same testing that drugs go through in this country at a minimum, and yet isn't it kind of hypocritical for the drug industry to be saying of these drugs that they're not safe when in fact they're using political pressure and lobbying power to make it easier for them to introduce drugs before they're properly tested? I mean, I may be leading the witness a little bit here, but...
I think what's absolutely fair here is that by some accounts, a majority of drugs that are prescribed in the U.S. And that we buy at the pharmacy are imported from abroad. They're actually manufactured abroad, and then we buy them here. And by other accounts, whether you buy a drug at a verified pharmacy in the U.S. or you buy one from a verified pharmacy abroad, you have the same safety issues. There's no greater risk to buying a drug that's prescribed to you for personal use from a verified pharmacy abroad than there is from buying it here. And I think that's why Kaiser Health News was reporting not too long ago that 19 million Americans now buy their drugs from abroad because it's half the price, a quarter of the price, sometimes a tenth or a hundredth of the price of what we pay here for the same exact drugs.
And I'm on this hypocrisy rant now, forgive me, but it occurs to me that a lot of the same people who are saying you shouldn't import your drugs from abroad, they had no problem. I wrote an article for The Nation about the research for a Zika vaccine. They had no problem taking U.S. Army-funded research into a potential Zika vaccine and giving it to Sanofi, which is a French and therefore, foreign pharmaceutical company. So if it serves the interests and relationships and social networks and everything that drive this whole system, it seems to me there's a little bit of a double standard at play. Suddenly, foreign pharmaceutical companies aren't so bad. Sorry, I had to get that off my chest. But so in a minute or so we have left, Diane Archer, what should people know, or where can people go to get more informed? What should people be demanding?
Okay, that's a lot for 1 minute. But
yeah, all right, two. I'll give you two.
Okay, good. About 2 out of 3 Americans are now going to doctors who are taking money from pharma, and only about 5% of Americans actually realize that. So one of the things people might want to look into is whether their doctors are taking money from the drug companies. You can go to Dollars for Docs. It's a ProPublica website that will tell you exactly how much your doctor is or is not taking from drug companies. And then you should question your doctor about the drugs he or she is prescribing based on what you learn. You should be aware that there is a website, pharmacychecker.com, that will tell you about verified pharmacies they have actually checked out abroad, and also what those pharmacies are charging for the drugs that you're taking. And then we should all be advocating for an independent Food and Drug Administration and for independent testing of the drugs that we're taking in this country. Other countries have independent agencies looking at the comparative effectiveness of the drugs that are available and helping people make smart decisions about the drugs they take, and we should be doing exactly that as well.
Well, that's a great summary. And where can people go to find out more about your work?
They can go to www.justcareusa.org to learn a bunch about what they can do personally to save money on their drugs, to navigate Medicare, and a lot more. And also to read about what's going on nationally at the state level on the big policy issues in healthcare and how they can get involved in that as well.
Great. Well, thank you so much for your work in this area. Thanks for coming on the program. Diane Archer, founder and president of Just Care USA. Good to talk to you.
Great talking to you, Richard. Thanks. Bye.